As we said, the government has a role to play to fill this gap. The public, the community, funding partners, donors, civil society organizations involved in disability issues, persons with disabilities and their own organizations themselves have a role to play in the community.
There are tangible enabling factors to the integration of disability within ICASA's response to HIV/AIDS. People with disabilities should be included at all levels, not only within ICASA, but also in all spheres of development. The rights and needs of persons with disabilities should be integrated into the national response to HIV and AIDS. Otherwise, universal access to all will be difficult to achieve.
We cannot have universal access. We cannot have zero infection. We cannot have zero death. We cannot have zero discrimination if we forget 15% of the world, if we forget 1 billion of the world.
But essentially, member states made commitments around recognizing the rights of people with disabilities, improving access to information and services, and providing financial resources to support the needed programming. We now have a strong mandate from member states to ensure that people with disabilities are not left behind in the response to AIDS. This has been a major turning point for our work.
For the next ICASA, the visibility of the disability issues and persons with disabilities should be outlined in plenary sessions. Furthermore, persons with disabilities or their representatives should be part from the beginning in various strategic meetings, such as in the International Steering Committee.
In the future ICASA, that they should have, a bigger space and appropriate attention should be given, and this is one of the things we learned.
Persons with disabilities had been taken as if they were insignificant in HIV programs and policies, but now it is the right time to incorporate persons with disabilities in every response of HIV/AIDS.
በአስገድዶ መድፈር or rape በዛ ነው ቫይረሱ ሊይዘኝ የቻለው ለ12 ዓመት
I am living with HIV virus for the previous 12 years. I became HIV positive after I was raped. We people with disabilities are more stigmatized and discriminated than people without disabilities. There is a double stigma in our community when you are disabled and HIV positive at the same time.
If you ask me, our targeted HIV prevention program's objective is to reduce the incidence of HIV infection in Ethiopia by promoting correct and consent condom use among most at risk and vulnerable population groups, but we've never thought of persons with disabilities before this partnership or before we have these sensitization workshops from HI. We are trying to implement some activities targeting persons with disabilities, like producing ICBCC materials in accessible formats, making our services somehow accessible to persons with disabilities, and we are also advocating or promoting the needs and rights of persons with disabilities in various forums.
Zero infection, stigma, and death will be only in the papers unless persons with disabilities are at the center of it. That is why the Ethiopian government awarded Handicap International for its contribution for the 16th International Conference on AIDS and Sexually Transmitted Infections in Africa. We hope in the coming ICASA, persons with disabilities will be more visible and heard. See you at Durban.
That's